Division today. So yeah, thank you. It's very great. It's gone really fast. It's been a really exciting opportunity, and hopefully it's the first 5 of many, many, many years serving our community. So at the Behavioral Health Division, we provide treatment to adults and children for really all behavioral health needs. So we serve people with mental health challenges. We serve people with substance use disorders. We have our own county operated programs, but we also collaborate with an enormous network of community providers. We have short-term programs, things like our crisis services and our inpatient psychiatric hospital. And really the most exciting thing we do is we've expanded to serve people in the community. We have many community-based programs that are much more accessible and much closer to the customers we serve than our current location out on Watertown Plank Road. So from the community health center partnerships that we've developed with 16th Street Community Health Center and Outreach Community Health Center, and hopefully very soon Milwaukee Health Services, we continue to be there for customers so they can come to us and get connected to really great quality services that are racially and culturally equitable and are really whatever they need from us, we're able to deliver to them.
Absolutely. Well, thank you for sharing that. And as you're aware, over the past 15 months, throughout this whole pandemic, this COVID-19 pandemic, there's been, I guess you could say, another twin pandemic also occurring, if you will. Can you tell us a little bit about that?
Yes, unfortunately, the opioid epidemic has continued to gain momentum this year. And really, just to call it out, I mean, substance use in general is on the upswing. Unfortunately, isolation and really a lack of other stuff to do has impacted people really all over the community. But the change in routines, the increased stress and isolation, and frankly, some hopelessness that is, with all the things going on with the pandemic, has really created a perfect storm for addiction. We've also seen a rise in anxiety and depression symptoms reported nationally. So 27% increase in depressive symptoms compared to 2019. And we saw emergency room visits due to drug overdoses increase 36% nationwide. Really tragically, the number that is just heartbreaking is that in Milwaukee County, we had our overdose deaths go from 418 in 2019, 544 in 2020. That's a 30% increase.
Wow. Those numbers are really concerning, seeing this rise happen. And, as a county executive, I've been talking to folks and literally giving folks resources and saying that if you or someone that is struggling with addiction, they can call us, and the quickest way is to call our Milwaukee County Behavioral Health Division crisis line. And for those who don't know that number is 414-257-7222. Again, I'll repeat it, 414-257-7222. It's a free call, and you'll be directly connected to someone that can help you. But I guess the other thing I would ask, Mike, is, what else can residents do to help somebody struggling with addiction?
Well, a big piece is just ask people or notice if someone is exhibiting a change in behavior, or the warning signs are there. People who have lost interest in activities, or they're isolating, or there's a concern. The only way to really engage people is to ask them and talk to them about their challenges. Unfortunately, there's a huge stigma in our community and around the world about mental health and substance use issues, substance use specifically. So maybe it is just that expression of concern that starts the conversation, but we have great resources and services available. And so for people out there listening who either have a challenge themselves or who have a loved one they're concerned about, the crisis line is a fantastic opportunity to get them immediate help. So that 414-257-7222 line, please call it and we'll make those connections. We also have a number of really fantastic opportunities and options in our community. This addiction impacts everybody. It's across all walks of life. It doesn't matter where you live or who you are or how rich or poor you are. Addiction is really prevalent, especially now. So BHD partners with a number of community agencies. There are 4 agencies that act as access points where people can get connected to great treatment for their substance use disorder. M&S Clinical Services is at 2821 North 4th Street. Their phone number is 414-263-6000. M&S has been a partner of BHD's more than 20 years on the Northside community. Impact at 6737 West Washington Street at 414-649-4380. Justice Point at 414-278-2140. And Wisconsin Community Services at 414-343-3569 can all perform a substance use assessment on the phone. They will come out and can do mobiles, and you can also go to those offices. But with the pandemic, we wanted to make services as accessible as possible. So all four of those agencies can provide an assessment, an initial assessment, to connect people with really positive services that meet their needs and that are really what they are looking for. We're not going to tell people what they should do. We want to hear what they need, what they want, and we're going to make those connections to make that first step to recovery. The key here is taking that first step is so important on the road to recovery. Those four agencies provide great service. And I'm so excited to talk about two new developments with BHD. We have two brand new partnerships with our local federally qualified health centers or community health centers. 16th Street on the south side is our Access Clinic South, developed in partnership with 16th Street Community Health Center. It's at 1635 West National. The phone number is 414-257-7900. The other one is on 210 West Capitol on the north side. We're calling that Access Clinic East. It's operated in partnership with Outreach Community Health Center. And both of those facilities are open during Monday through Friday, 8:30 to 2:30 for walk-in assessments. If those times don't work for you, just please call the number, and our very competent and experienced staff will help make a connection to the services that you need.
Absolutely. Thank you for sharing that information. It's a lot of great information that you are sharing. And when you think about, this pandemic and the toll that it's taken on so many people, I mean, we started to see the rise in crisis calls, right? And so, that's one of the reasons why, Milwaukee County, or BHD, we use CARES Act funding to really increase our prevention services, both for substance abuse and suicide. But I guess the other question I would ask, what other substance abuse disorder resources are available for Milwaukee County residents?
So the biggest challenge, and we are part at the county, part of the city county heroin, opioid, and cocaine task force. The biggest challenge we heard about was housing, so safe and sober housing. So we've worked with a number of community partners to expand opportunities and for safe and sober housing. We have access to residential treatment, which has been greatly improved because of some changes over the last year with the Medicaid benefit. So we can make connections to residential treatment if that's the level of care people need. But we also have program called Outpatient Plus, which is essentially a sober house, a sober apartment with services wrapped around people. And one very interesting resource that was developed, really, it started at the beginning of the pandemic, and we rolled it out literally 2 or 3 months before the pandemic, is a program called Oxford House. Oxford House is a national organization. They have thousands of houses. These are democratically operated individual houses that are self-sustaining, and they're basically run by the people that live there. All the people living there are in recovery. In our community today, most of the people at Oxford are in recovery for their opioid use disorder. We, in the past year, have developed 6 houses. So there's 4 houses for men with a total of 37 beds, and 2 for women with a total of 17 beds. One of the women's houses actually can accommodate children as well. So we've had 54 new residential beds established over the last 18 months. There's more on the way. Our arrangement with Oxford House calls for as many as 10 houses to be developed by the end of this year. And the model completely embraces recovery. Each of the residents has to have a job. They have to contribute to the house. They have to be part of the whole success of the house. And what it does is it teaches people the life skills that they need to be successful in the community. Additionally, we have a grant-funded program that we deliver through the House of Correction, where we provide people who are in jail related to their substance use disorder, because I don't think it's a surprise that people with chronic opioid use disorders find themselves in jail from time to time. And so the goal here is for those people to begin recovery at the House of Correction before they leave. We get them started on important medications. We use a drug called Vivitrol, which actually prevents people to be able to get high from opioids, and thus helps them in their recovery because they basically have no incentive to use drugs. The shots start well before they leave the house, and we wrap services around those folks there, and they're allowed to continue those services when they get into the community. The single most dangerous period in a person in recovery's time of recovery is right after they get sober, because they lose their ability to tolerate the drugs. And if they relapse, they're at an extremely high risk for death and overdose. And so this program and many others focus on making sure that people have everything they need to keep them safe, to help them to, when they have that moment of urge or whatever, they have someone to reach out to, but also provides them with the medication-assisted treatment that helps them along their path of recovery. So again, housing and treatment, those are two huge things that we've made amazing strides with in the past year, and we're very proud of. Again, we have a long ways to go. There's a lot of need in the community, but if you reach out to those numbers I've shared, and if you are a person out there and you need help with housing and you want to consider Oxford House, you can reach Oxford House directly by calling their outreach worker, Ryan, at 414-208-5510. That's Ryan at 414-208-5510. It's a fantastic resource, and they have capacity today.
That's awesome. And I know that we've been doing a lot to also educate people around Narcan as well. And so, you know, I know a lot of people always ask the question, can anyone administer Narcan? Or does it only have to be from first responders or medical personnel? And I just want to let folks know that that Narcan it's a medication that can reverse an opioid overdose. And so it can be given as an injection or as a nasal spray, and anyone can learn how to safely administer it and save a life. Matter of fact, the statewide standing order for I want to make sure I'm saying this right. Naloxone. How do I pronounce it?
Naloxone.
Naloxone. So this allows pharmacists in Wisconsin to sell naloxone without a healthcare provider's prescription to anyone at risk of an opioid overdose, as well as their family, friends, and anyone who may be witnessing an overdose. And so I guess the question I would ask is, you know, what should residents do if they suspect a loved one who may be suffering from a substance abuse disorder?
Well, I would encourage family members to try to talk people into getting help. You know, it's everybody's different. Everybody responds differently. I think engaging them in the conversation, expressing concern for them, expressing concern for their well-being, and maybe, you know, connect them to some of these services. We encourage people to reach out to us. A mental health crisis or a substance use disorder crisis doesn't just end with the customer who's having the crisis. It's a crisis for their family as well. So please reach out to us. We were happy to partner with people and help them. You know, as far as Narcan goes, you are absolutely right. Narcan is mostly deployed as a nasal spray. Anyone can do it. There's a very brief training. Anybody can walk into a pharmacy and ask for it, and they will be given Narcan and the instructions as to how to use it. If you're concerned about a family member and they're using opioids, every single time they use that opioid, they are at a risk for dying from an overdose. And so, and that's because of the prevalence of fentanyl in our community, which is a very dangerous additive that's added into the heroin to make it stronger. It means that even experienced users are taking the risk of death every single time they use. And unfortunately, for people who are addicted to opioids, the risk of death is not a deterrent. And so they need your help as a family member, and they need our help as a community to make sure that as many people as possible are educated about the use of Narcan and have access to that drug. So I can't say enough about Narcan as a preventative measure. The goal is to keep people alive so that they can eventually engage in treatment and get better and get on the road to recovery.
Absolutely, and we all have to be present and patient when you're dealing with that. And as you can tell from this live, that there's a lot of information that Mike is sharing. But I guess, Mike, if you know, is there anything else you think it is important for folks to know?
Just that there is help. I think there's a lot of hopelessness around opioid use disorder. People think, well, people once addicted never get better. That couldn't be further from the truth. We have many colleagues who are part of our treatment delivery system that are in recovery, long-term recovery. So many people have recovered. So many people get better. It starts with that first phone call. It starts with that first bit of information. It starts from that spark that maybe comes from the support of a family member or a friend, or just, you know, sometimes it's a random stranger. You know, it's just that sense that somebody cares about me and getting that foot going, getting that first step forward into recovery. So I would just say that hopefulness, again, we have lots of resources. We have capacity today. If it's an imminent crisis, call the crisis line, please. But really, it's the rest. There is an option. There is a help. There's an outcome here that's positive. Addiction, substance use disorder doesn't have to be the end. Recovery is absolutely possible, and in fact, it's a likely outcome if we give the people the support they need.
Absolutely. And we got a question in the chat that I just got, which is, where can people get help with the cost of naloxone?
The Vivint, which is formerly the AIDS Resource Center, can provide naloxone for free. There is a number of other options for free naloxone. Is there a way for me to post like links or connections after this that stays with the chat?
Yes, we can do that.
Okay, I will make sure to get the number for how people access naloxone. The Behavioral Health Division does supply Narcan to many of our provider agencies to just give out for free. So there are ways to get it for free, and we're happy to help with that.
Really appreciate it. Again, you've been sharing a lot of information, and sometimes the first step to receiving care is the most difficult. And so it's good to know that the BHD clinicians will take the lead in really helping all of our residents find the resources that will benefit them the most. And so let's all make sure that we're continuing to check in with ourselves and our loved ones, our friends, and our to our family and friends about substance abuse, and making sure that we stay ahead of this, particularly as we are coming out of this pandemic, and we know that the toll that has had on many of our family, our friends, and our residents. So thank you so much for joining us. And until the next time, let's make sure to share this information with as many people as possible. Thank you.